Welcome back to Rupture, the World of BestGuessistan. I'm Wendy Lurie. Dr. Melody Merati is back. And today we're going to be talking about the 10 to 30%, those of us whose concussions don't resolve within 10 to 14 days. Because when you fall outside that timeline, everything changes, not just the injury, the expectation. And if you're part of that group, you are not alone, and you are not the problem. I am delighted to welcome back to Rupture Dr. Melody Merati. Dr. Merati is a neuro-ophthalmologist and my concussion neurologist. And welcome. Thanks for coming back to Rupture, Doc.
Thanks so much for having me again.
No, it's really to be able to continue this conversation is of great service, not just to me, but to our audience. So the last time we talked, we sort of talked generally about TBIs and what's going on in the brain. And I thought for this conversation, we could focus more narrowly on, I'm a member of this group, the 10 to 30% of people who get a concussion and don't recover in 10 to 14 days.
Yeah, absolutely. It can be extremely stressful for those patients because they're told, this is the normal. And so when someone doesn't fit in the normal box, you're kind of left out there wondering, like, why am I not getting better? And so I often run into those patients all the time where they lose a lot of hope because they were told, oh, this is how it's supposed to be. And oftentimes they think that they're going crazy because they're like, why am I not getting better? So those patients, oftentimes we do know there are certain predispositions that they don't get better in a certain period of time. And so, if they have the history of migraines or if they're having, multiple concussions in the past, we know that those patients have a lot harder time to recover in that time span than patients who don't have that history of concussions, migraines, if they don't have any injury to the brain before. So often we also know that there are other components that lead patients to have a more difficult time for recovery, including, like we talked about, environmental factors, but also, there's genetic predisposition. And then also the older population has a little bit more difficult time recovering. I have a lot of older patients who've had a concussion and they're still struggling for months and months and often for years too. And so it can be very difficult for those patients. But at a certain point, I think as providers, we need to stop telling patients that you're definitely going to recover in this period of time, because I think that's also a problem too, the providers telling patients that.
I think so too, because it's establishing an expectation. And what you were saying before about patients getting frustrated, I think that's absolutely true. Another thing I think patients feel is guilt.
Yeah.
Because if you're told you will recover in this period of time and you don't, you feel like a failure. This isn't the problem. I'm the problem. I can't make myself better. And just that extra layer of guilt,
Absolutely.
especially in the early days when nothing makes sense.
Yeah. I mean, in high functioning patients who, they had a job before all of this and they can't function at their job, they feel a lot of guilt. They can't provide for their families anymore. They feel a lot of guilt about that because they used to be the sole provider for their family and now they can't do that. Yeah, it can be very problematic. And I think the guilt is something that I see a lot, especially, patients breaking down about it because it's coming to a head at a certain point. Why am I not recovered in, 6 months? I was told I was going to recover in 14 days.
Which is feeling like you're responsible for something that you actually have no control over.
Yeah.
So you were mentioning some of the factors that make it likelier that someone will be in this 10 to 30% group, prior concussion, migraine, age, all that. Has that ever been quantified? Like how much likelier is someone to have this long-term issue if they've had any of those sort of pre-existing conditions?
Yeah. I mean, they've done a lot of research on this, but, I don't think there's a specific number that gives us like a quantification about that. We do know, like, if someone presents on the table with like multiple symptoms, they found that, having multiple symptoms puts you like 20% more risk of having a longer recovery period. But again, every person's so different. And so it's hard to say, oh, about 5% of the time this will happen, because we know that's not true in the real world, in clinical practice.
But you said something about the symptoms. So do certain symptoms indicate likelihood of this persisting?
Yes. Migraines is a big one, and oftentimes migraines is something that's the most difficult to control after a concussion, but also people presenting with memory loss, they're having a lot of concentration issues, they may have a lot of trouble sleeping, fatigue, dizziness. Dizziness is a huge one. Dizziness can be very, very difficult to control after a concussion, but and I'm sure we'll talk about this later, with the therapies can oftentimes recover. But the more symptoms patients present with, oftentimes the longer it's going to take for them to recover than, let's say, somebody who just comes to see me with just, oh, I'm
One
just,
symptom.
yeah, I'm just having
Yeah.
a bit of visual problems and that's it, nothing else.
So quantity of
Yes.
symptoms makes a difference.
Yes.
And then it sounds like dizziness could be a predictor of the longer. What are there other ones that indicate sort of likelihood of persisting?
Yeah. So, I think there's a ton of post-concussive symptoms that we often see in the clinic. Here's the thing, because it's so difficult to get access to healthcare, sometimes I'm seeing those patients months out after they had the concussion. And so the symptoms that they're telling me that they initially had after the concussion, those have gotten better. But oftentimes those include the mood changes, dysregulation, again, the pain that comes along with it. They may have visual dysfunction, they may have a double vision, or they just might feel like they're having focusing issues. And so there's a vast majority of, you know, physical and mental symptoms that are associated with concussion and post-concussive symptoms. And so getting a good baseline of what someone had before they had the concussion and then what are they like after the concussion, so I can kind of have an idea of where they are in the recovery process and how difficult it is for them to recover. So getting
Yeah,
that history, do they have history of depression, do they have a history of anxiety, is that going to play a role in this too?
and do those play a role if they have histories of those of things like anxiety and depression? That
Yeah, I mean, I think, that plays a role into a lot of things, but especially in concussion, because somebody who has let's say, a history of severe depression or severe anxiety, the concussion can certainly trigger those symptoms even more. And so, if someone has a lot of anxiety about their concussion and post-concussive symptoms, then it's going to be harder for them to respond to treatments because they, certainly can provoke anxiety and then provoke depression too. And so if somebody's not, their mood is problematic.
yeah. No, that makes a lot of sense, and I can definitely relate to the anxiety part of it because I had managed I would call it managed anxiety before,
Yeah.
but post, it gets triggered by just about anything. It's like it's much everything's much more sensitive.
Yeah, exactly.
I wanna go back to the headache thing for a second because, we're talking about migraine. Is it common for people who go through this, who don't have a history of migraine to develop migraine from the TBI?
Yeah, I have a lot of patients who've developed headaches after a TBI, who never had history of headaches. It's a little bit more common though to have the patients who have history of migraines get their headaches get a lot worse after the concussion. But there's a small subset of patients who develop headaches after concussion. And I know for you, you did have headaches before your concussion, but yours certainly got way, way worse.
I've had migraine since I was 17.
Yeah, yeah,
And it definitely made it worse, but I do find that the some of the medications to manage migraine, like the things to prevent it, which reduce the auras, actually do sort of they don't help the concussion pain because the pain for me, at least, the pain is in layers, and I can tease apart which pain is which. So they'll deal with the migraine, but they won't deal with the concussion pain
yeah, yeah.
because
Right.
in me, those are distinct, but they may not be in everybody.
Yeah, and that's interesting you say that because those medications are specific to migraines, and so that's
They work.
yeah,
Okay, so I wanna go back a little bit to sort of visual system issues because that's your area. I mean, among your many areas of expertise. So the visual system. So we talked about this on previous podcasts, but a lot of people don't necessarily recognize that some of the symptoms they are experiencing can be a result of the visual system. They
yeah,
don't necessarily like, I mean, the dizziness, for example, may or may not seem connected to that. So how often are visual or ocular motor issues a hidden contributor to symptoms like headaches, fatigue, cognitive overload, dizziness?
yeah.
What's the role of vision?
Yeah, the majority of the time, actually. Some patients will come to see me and they'll say, I have distinct double vision after my TBI, after my concussion. And so when they come to see me with those visual symptoms, then I tease out, okay, is there a cranial nerve that's involved? And a lot of times we see cranial nerve 4 palsies involved. Yes. And so some patients they will not have distinct double vision, but they will just say their visual world does not feel right. Something feels off
Mm.
vision. And then when they tell me that, they say, and focusing can be very problematic because then it causes eye strain and that triggers headaches. And so teasing out, okay, do they have, a convergence insufficiencies when the eyes don't, they're not coming in to see a near target from the concussion, or do they have a cranial nerve palsy from their concussion? And so, yeah, there are the majority actually of patients who come to see me post concussion, and it's probably because I'm a neuro-ophthalmologist, but they'll tell me that their visual world feels off, and so
Mhm.
it's our job to figure out what's going on with that.
So that makes a lot of sense and is very familiar. So besides the double vision, which can be from the fourth nerve palsy, what kind of other visual symptoms do you most commonly see in patients with this?
Yeah, so reading can be really troublesome because their brain is no longer telling their eyes what to do anymore because of the concussion. So looking at phones, computer screens, people will have sensitivity to light after their concussion. So many different visual symptoms are associated with concussions. And, like we talked about, convergence insufficiencies, multiple cranial nerve palsies can cause issues with the vision, difficulty focusing. There's a vast majority of visual symptoms because the vision is so related to the brain.
Well, and you were saying, I think, did you say the brain was not telling the eyes or the eyes were not telling the brain, or is it both?
Yeah. Yeah, so the what happens is the brain has difficulty in controlling the eye movements. So that from the mechanical stress of a concussion can cause issues with your vision. And oftentimes patients will have difficulty after the concussion with, you know, seeing fast moving cars because that visual input is too stimulating for them. And so that triggers, dizziness. Seeing being on subways can trigger a lot of vestibular symptoms. The list goes on and on. But our visual input is so important for because if you're seeing double vision, you're gonna fall. You're gonna have dizziness. You're gonna have difficulty focusing. You're gonna have headaches from as a subsequent problem from that. So
There's still a lot of TV with fast moving things that I have to watch like this, and it's 3.5 years later, and that doesn't seem to have improved. Okay, so let's go to persistent symptoms because we started talking about that. Uh, and let's just go deeper into that. So like what persistent symptoms actually look like in this 10 to 30%. So visual, we were just talking about, vestibular, so the dizziness, which a lot of which has to do, you're saying, with vision.
uh-huh. Yep, that's right. And then the
Yeah.
dizziness can also be associated with there's small crystals in the inner ear. And so if they from the mechanical stress of a concussion get dislodged, then that can cause it.
So is that the one that's like cured by the Epley maneuver? I think we had to DIY that at home, but that so they can get dislodged from a concussion and lead to the dizziness. Right.
Correct.
Right.
Oftentimes that type of dizziness is way more severe than dizziness it's coming from like a central like a mass or tumor in the brain. And so those patients who have the dizziness from like a crystal that's dislodged in their inner ear can be vomiting profusely, the world is spinning on them, moving their head into certain positions causes severe symptoms. And so that can be from a concussion as well.
Wow, because it wasn't hard enough. Cognitive issues, definitely. What kind of cognitive issues do you see?
Yeah, cognitive issues, that I will see are is brain fog. People with
Mm,
a lot of brain fog from, a concussion. They might also have problems with their mood. They no longer find, but that comes along with the history of depression. They have, the worsening depression and anxiety. So it all really plays a role together. And oftentimes if someone is having difficulty with a lot of mood issues, I'll refer them to psychiatry or
right.
psychiatry colleagues because at a certain point, I think medications can help with that, along with other therapies too. Yeah, mood
Well,
has
it's interesting because I did not have a history of like light anxiety and no depression.
yeah,
But I have found that it is harder to regulate mood and emotions post TBI, like something that was never a problem before.
yeah,
I solved it by working out,
yeah.
but it is definitely more of a challenge than it used to be.
Yeah, I mean, and if you think about it, anyone who's in constant pain and constant dizziness, constant visual, it's like, if you don't have mood problems from that, it would be surprising. If you're dealing
Right.
with these symptoms 24/7, it's can be cause a lot of issues, but it's not unexpected.
No,
Yeah.
no. The headache and the migraine, I wanted to ask this only because, like, when I go and, like, talk to when I'm engaged in a conversation with a community, say, with the Reddit TBI community, and people are talking about their symptoms, pain doesn't always come up, and even when I've talked to other people and interviewed other people for this podcast, 3 of them come to mind. Not a single one mentioned the headache. They all talked about the other symptoms, and I was like, "Wait, I know I can't be the only one who has the headache, but is it more common to have it or not to have it? Because this little anecdata I'm getting is a little confusing.
Yeah, and, you know, it is common to have headache, and I know this because I treated a lot post-concussive patients. I treat it in 90-year-olds, I treat it in 20-year-olds, so it really doesn't matter how old you are, but older people do have, a worse time with recovery as far as duration of recovery than younger people.
Right.
But yeah, no, it is common, and it might just be their brain has been able to their hypersensitivity of their brain has been able to regulate the pain better, than other people. And, we know that women have a harder time with migraines, post concussion.
Yes.
Potentially, it could be from the sheer force of a concussion. Women oftentimes will have a less of a neck mass. They'll have less muscle.
Mm,
So when that because of
I'm reliving mine right now.
yeah,
Yes.
our anatomy is different in females compared to males. And so, does that mean that, when we have a concussion, if it's a pretty large impact, our head is rocking back and forth harder than like a male? It's possible. But yeah, no, I treat a lot of migraine, and headaches post concussion. And, what I would say is in my clinical practice, I do see it more in females compared to males, but I do treat males too. But yeah, I mean, I think in those patients, maybe they've found treatments that have helped for their pain aspect of their migraines. But yeah, that just kind of goes to show it's really dependent on the person.
Right. But even separate from the concussion, I mean, incidence of migraine in women is higher than in
Correct.
men, right? I mean, I thought men get it as in the form of a cluster headache.
Yeah.
Right.
Yeah.
We have a lot of expertise in the family on that. My brother gets cluster headaches. I get the individual one-off migraines, but
Okay.
we're deeply experienced.
Yes, I know you guys are.
What about fatigue? I talked to someone recently who said she could not stay awake after her head injury. She would literally fall asleep while she was sitting on the phone.
Yeah. Fatigue, I don't see as often as I do the other symptoms, post concussion, but I think fatigue also comes along with your brain is trying to function so hard to, you know, doing the normal things that you were doing before the concussion that your brain just needs breaks, longer breaks. And so that, to her might be she needs to take frequent naps or increase rest periods. And I think that goes along too with, patients who are on the computer for a really long time after trying to do their normal things, but they can't because that the bright light. So I think it's the symptoms of the concussion that really make the fatigue a lot worse.
That
But
makes sense.
everything's interrelated.
So, well, the sort of connected one with that one is sleep disruption.
Yeah.
You see that a lot?
Yeah, I do see that a lot. I think it is again more common in patients who've had that before the concussion, that they have trouble with sleep too. Yeah, and so there are all these remedies that can help, like melatonin and those, and not using your phone close at near bedtime. So try not to get too stimulated at
So
bedtime.
good sleep hygiene
Sleep.
recommendations, right?
Yeah. Yes. Exactly.
So on the symptoms question, this is slightly farther afield, but what other conditions do you see arise in patients after they've had a TBI? Like I know autoimmune
Mhm.
is one that can happen. It happened to me. I've looked it up. Apparently, it's I wouldn't say it's common, but it's not that uncommon because every rheumatologist I talked to said any assault to the body will be met by your immune system. Like that's who will react first.
Yeah.
And other people have told me about GI problems that they developed after they had a TBI that they never had before. So, like, first of all, why is this happening? And are there others besides like just those two examples that you're aware of? But like, first, why is this happening?
Yeah. I think in part it's your body's trying to respond to a force of that dysregulated neurons in the brain, and the body is trying to meet energy supply. The demand is higher than what the body's needing, so that can cause havoc on your whole body. Really, because I'm no neurologist. Anytime someone complains to me about GI issues, I always refer to our to treat anyone's GI issues, but
Right, that's a different lane.
it's a different lane. But I think that, that's why we all have our respective fields, is because
Right.
most appropriate for that. But yeah, I'm sure GI specialists have seen that commonly occur. It's not something that I've really looked into that much though.
Yeah, it's interesting because you think about it just as a brain injury,
Yeah.
but then the brain is controlling everything else. So of course it would affect other systems. I mean, it intuitively makes
Yeah.
sense.
Yeah, it does. I mean, if like cranial nerve, 4 palsies in double vision, because of that, people will have a head tilt. to try to align the eyes together. What happens with the head tilt? The muscles from the rest of the body, they will contract in a certain way. And so you'll have trapezius dysfunction. One shoulder might be a little bit higher. That goes down to the rest of your body. So you might have a little bit more pain on that side. So yeah, everything is really, it's very related.
Well, that makes a lot of sense, and maybe explains the autoimmune disease I developed within 30 days of the head injury. It may not, but it's as good a theory as I've got.
Yeah.
Okay, treatment. Let's talk about treatment, especially with this group. I had a conversation with someone on an episode where she actually interviewed me and we were talking about treatment and we split it up into two different categories, right? So the treatments, meaning like medications, injections, things like that, and then therapies like for rehab to sort of improve that you kind of regain what you lost, some of the deficits, right? So I mean, this is an impossible question to answer, but I'll ask it anyway. Like, why do some treatments work for some people in this 10 to 30 and others not? Are there any sort of things that indicate likelihood to succeed or likelihood not to succeed?
Yeah. So, usually when we are talking about, so when I approach a patient with treatment for post concussion, therapies are always so important. I mean, I think there's not been one patient that I've not recommended therapies for, one of their symptoms or another. And so that comes along with, yeah, we'll start therapies and along with medications. If someone, let's say, doesn't want to start a medication because they're, medication naive or they have side effects, then we'll we will start with like some vitamins that are recommended by the American Headache Association if they're suffering with headaches. But usually when we're getting to the third, fourth line therapy for, let's say, the medications, or they've been in therapies for a really long time and they're not getting benefit, those are the patients that we will, sit down with them and talk to them about, okay, maybe that it might take longer for your symptoms to get better, or we might have to think about this new normal, and try to adapt a different world than what you were before. But it's more of a conversation of, okay, now we've gone to the third line, fourth line therapies, and we haven't seen too much improvement, so let's talk about what your timeline may look like.
This is the sort of like the transition point. I was gonna call it the tipping point, but don't need to call it that. But like at a certain point, it becomes clear to you that a patient is just not going to get better from these treatments, right? And like maybe when you're on the fourth line treatment or there's some other sort of rubric for figuring that out. When do you start to recognize that a patient might be in like the long tail of this long-term concussive period? And how do you talk to patients about it? Or do you wait for them to talk to you about
Yeah, so oftentimes it'll come along with someone telling me that they feel hopeless because none of the therapies have worked. It's those long term relationships that I know I know a patient, what they're normally like, and so when they come to see me and something feels off and something feels different, that's when I might approach them with a conversation of, okay, you know, we're at this point where we've tried almost everything. What I guess moving forward, what do you want your new normal to look like? And sometimes I'll approach patients with that, but sometimes patients will approach me with it. So let's say there's still a couple more therapies that we haven't tried, but everyone gets tired from trying something new and thinking that, oh, this is not going to, why would this one work? The other six have not worked, right? And so sometimes I wait for patients to kind of tell me when they're ready to kind of stop trying new things, because we can always think of something new to give you a trial with. There's always, for the most part, until a certain point where we're at a point where, okay, we've tried infusions and that doesn't work, then we have a lot of tools in our tool belt. But I think it's a conversation that sometimes starts with the provider, sometimes it starts with the patient.
Well, that's connected to this next part because it's about the idea of what is acceptance, which feels okay, versus giving up, which doesn't really feel as okay. And I mean, I had to go through this. I'm sure a lot of people have to go through this, which is recognizing that you called it the new normal. You'll never get back. You'll never get back to who you were before. Like those days are gone. And which is really, really tough, especially like you mentioned among high functioning people, but I think among anybody, just like I want to be who I was before. What does acceptance mean in this context?
Yeah, acceptance means figuring out, you know, who you are post concussion, and, acceptance is understanding that you're okay with who you are post concussion and that you've learned to deal with it. Maybe not as well as you had hoped, but figuring out strategies to cope with it. So, strategies being taking a lot more breaks, talking to your employer, or if you're not working, figuring out what your life will be like. At home with family, getting help if needed. So Acceptance can be in a lot of different forms. But, some patients also learn to do new things. Like you,
Mhm. I was not a podcaster
right?
before.
Exactly.
I wrote but wasn't an author, so yeah, no, it's true. That is true.
Some of my patients have turned their pain into art.
Mhm.
So acceptance is realizing that there are other things out there that you can do to kind of put your pain into something else, or your other post concussion symptoms into something else. So yeah,
As long as they have someone to talk to about it, because a lot of the stories I read and the people I talk to are just sort of they're stuck.
yeah,
They don't know how to get to that, "Who am I going to be?" All they know is they're no longer who they were, and they're in this sort of yeah, this interim period where they're not who they were, they don't know who they're going to be, and they don't know how to get there, and they're just trying to get back, and they're stuck in the middle.
yeah, yeah. It's true. It's those middle people that's can be because maybe they don't have access to healthcare, or they live in an area which don't doesn't have healthcare readily available. Which it's we see that a ton. Patients traveling super far to get to a provider, but then it's not like they can do that on a monthly basis or on a biweekly basis, right? They can't get on an airplane. They already have post-concussive symptoms, right? So, yeah, it's tough.
Actually, you segued as usual and perfectly to the next section, but before we do, I wanna just ask you, flying, what is the impact on flying?
Yeah, so flying can triggers. Sometimes flying can trigger bouts of the crystals in the ear
Mhm.
moving, shifting around because of the changes in the barometric pressure from an airplane. So if you have history of that, it might trigger things a little bit. Um, Headaches can headaches can also be a result from flying too. There's no real contraindication to flying unless you had a severe concussion and you need, you had a lot of traumatic brain injury, imaging. But there's no real, it's not like you should never travel again. It's more like, okay, thinking of coping mechanisms and having treatment with you just in case things get triggered a bit.
Right, including just the stress of having to wait on
Yeah.
5-hour TSA lines. I mean, the stress alone can make everything worse. I recommend meditation apps.
Yeah. Oh, that's great. Yeah, exactly.
Okay, so you mentioned the, insurance, and that actually is the next sort of topic, which is the system problem, right? We have this 10 to 30%. They have long-term persistent symptoms, and they need care, and there are barriers. So one barrier that you mentioned, right, is just proximity to, a major medical system that has, concussion neurology. Like, that's definitely one, which just be geography, but what are the other barriers to people getting care, especially in this sad group I'm part of?
Yeah, I mean, you had those patients that have maybe lost their jobs from their concussion because they couldn't do their jobs that they once were able to do, and then they lost their insurance secondary to that. And so that is so difficult to see. You know, it's really it's unfortunate. It's terrible, actually. They, you know, that is a huge, huge problem in the healthcare. If they can't get care, what are they going to do? Maybe their insurance doesn't cover, getting more physical therapy or more vestibular therapy or more vision therapy after a certain number of sessions. If they're still very symptomatic, what are they supposed to do?
What do they do?
Home exercises can really only take you so far. Like you need a expert, and these therapists are experts, and to get you quicker to your a different baseline. So yeah, it's really tough.
And I think you'd mentioned the last time we talked that there also aren't enough neurologists.
Yeah, that's right. There are not enough neurologists, and that's a big problem. And especially, we need more neuro-ophthalmologists too. So, working with medical students and residents, I'm always trying to get those trainees excited and interested in the healthcare fields of neurology and neuro-ophthalmology because we definitely need more. And I think that will help too, especially in areas where patients don't have access to that. But I think in those areas, family medicine doctors have really become they're able to do everything now because their patients don't have access to those consultants outside. And so yeah, it's great that they're able to help with patients who have concussions, and they're able to get patients those medications, the specialty medications too. And we've seen that a lot as well.
So that is happening. So primary care can
Absolutely.
that's good to know.
Yeah, absolutely.
Because someone I had spoken to was really only seen by her primary care.
Uh-huh.
Got the old guidance of full cognitive rest, no screens, lie in a dark room for 2 weeks.
Okay.
And then when she mentioned something about seeing a neurologist, her primary care said, "I don't really know that there's much they can do for you." So kind of I mean, she went one time, but she didn't go in with the attitude of, "This is something that can help." She went in with the attitude of, "This is probably not going to help," because that's where the expectation had been set.
Yeah. Right. Right.
But the difference between being able to get to a specialized provider versus like, what does that mean in like practical terms? If you can only be seen by your primary care versus if you can actually get yourself to a neurologist, like what what's the difference from a patient point of view?
Yeah, I mean, with all different specialties, neurologists have more expertise with neurologic disorders like concussion. So they're going to be more able to treat patients with concussion than we don't have the expertise as to to handle less family medicine, a lot of
Mhm.
family medicine or internal medicine issues that they are the experts at. And so it's all about who is the most apt to deal with your problems, right? So if somebody has these visual issues and their family medicine doctors I'm not sure, what's going on. And then they go see a neuro-ophthalmologist and they diagnose them with a cranial nerve 4 palsy. They can get the prisms to correct it. They can get vision therapy to help with the cranial nerve palsy. If they have a convergence insufficiency that may be missed, they can get the vision therapy with the convergence exercises. Then they can get better from that. So neurologists can certainly be super helpful in neurologic disorders. And just like I mentioned before, like I'm not going to treat a GI disorder because I know that's not where where I
Right.
so I'll refer those patients to GI experts. And so, yeah, but it is true. It's all about the if you have a attitude that is defeatist about something, then you're going to go in the mindset of being that way too as a patient. It's very evident even in the hospital setting. If you have a defeatist attitude about when you're taking care of patients, it's the patients and their families are going to feel the same way too.
Yeah, it's a self-fulfilling prophecy.
Yeah, yeah, definitely.
I think about these people because I do come across them in the work of this project who, because of reasons of either insurance or geography or awareness, just never get to the right provider, to the right clinician. What happens to those people?
Yeah. It's hard to say because, we don't see them, but,
It's
but
just it's heartbreaking because even with the access, this is a difficult, really difficult problem to live with.
yeah. So, yeah,
I
without that,
didn't
it's even
Yeah,
harder.
that's not a question either of us can answer. It's just
Yeah,
like it's just so heartbreaking.
absolutely, yeah.
Okay, we're coming in on the close. So lived experience. So when I talk to people who are in this sort of long tail, they do describe feeling like they're trapped between two worlds, right? They're not so symptomatic that they can qualify for support, or you're not disabled enough to qualify for disability as an example, but they're also too symptomatic to function normally. They're right in between. And by the way, because this is an invisible disability, they look fine, and in most cases, many cases, they sound fine
Yeah, right.
and they're stuck in the middle. So, like, do you see that dynamic show up in your practice of like, I'm sort of too injured, but I'm not injured enough?
Yeah, I definitely see that in my practice. I see that a lot in my practice actually, where they can do their job, but they know they're not doing it, the best of their ability like they were before the concussion. So oftentimes they're asking for accommodations to kind of get close to, the productivity that they were at before, which is reasonable, right? Things in the normal workplace are very triggering for concussion patients. Like the lights, even for regular migrants, the bright lights, they have these certain terrible lighting systems that
The
can
worst.
the loud noises. You're not going to want to sit in an office and converse with people if you're dealing with pain, or if you're dealing with fatigue or mood dysregulation. And so, yeah, the middle lane is can be really tough.
Yeah, it's and I would think that that middle lane, because it's so challenging, can also lead to more anxiety and depression, and like this,
Circle,
just right. It becomes a snake eating its own tail, and it just keeps going. Like it just gets harder and harder.
correct. Yeah,
Yeah. Yeah. I mean, honestly, for me, the only thing that got me, over the wasn't really depression, but I would just describe it as like my the second year of this was dark. It was sad and it was dark
yeah,
because we had done a lot of the treatments, but I also hadn't figured out who I was gonna be post.
yeah,
And it really wasn't until I started doing all the writing and all of this work that became the therapy that worked. That became the only thing that got me through it, and I would love to know that everybody has a way out of this, and it doesn't have to be writing, and it doesn't have to be content creation and podcasting, but something that you make of the life based on who you are now.
Yeah, and I think it's really helpful for people going through it because it's really understanding and knowing that you're not alone. And so I think oftentimes people feel like they're alone, especially when they're told that you should be doing better. Why aren't you doing better? And it's awful. It's awful. So it helps. It really helps people a lot.
You know, and it's awful, and also, like, that question of, like, "Why aren't you better?" is often very well met, right?
Yeah.
It's well-intentioned,
Yeah.
but it just makes the person with it feel even
Yeah. Or
worse for not having recovered on the schedule, and
yeah.
more guilt and more shame, right?
Yeah.
So, okay, so final not well, almost final question, what's missing? So, in terms of research, like, what are the biggest gaps around these persistent symptoms?
Yeah. I think.
What should we be studying that we're not?
Yeah. I mean, I think. Looking at, the people who don't recover, and I know that's how we started, but that's how we're gonna end too, but looking at those people who don't recover, what is I guess, the number one thing that's, not allowing them to recover. We know there's a genetic component to it, like we had discussed before. So people have certain genes. They're less likely to recover from a concussion than people who don't. But what are some other things? I think that's like research that should be ongoing too. There has been research out there that's looking at should patients be tested for specific genes before they go into sports that have a high likelihood
Mm,
of getting a head injury to know, like,
interesting.
how long should they be out for after concussion. So I think more of that research would be super helpful for the sports world as well as people out in the regular world who have a high likelihood of having, head traumas. Actors who are doing a lot of stunts and sorts of things, like, understanding the brain more.
That makes a lot of sense. So, final question. Back to the 10 to 30% of us. If you could tell patients in this group one thing that you wish they had understood early in the journey, what would it be? And you sort of referenced it at the very beginning of the conversation. So, that we'll complete the circle. But what's the one thing you wish people understood earlier on?
Yeah, that that they are not alone, that there's a lot of people going through the same thing. And if they're seeing someone who they don't feel is helping them, or is their gut is saying that, this is not working, find someone else that can find a different provider, find another opinion. They should never just stop looking. But at a certain point, feeling comfortable with your provider, is really beneficial for those patients because then they're more likely to tell the provider what symptoms they're experiencing, and they can get more help that way. But just the feeling of we see this where patients don't recover in the typical fashion, and it's okay. And so that's a big thing.
Yeah, yeah. And I'm guessing you would never say anything like that there's a possibility that this may take longer than you think, than you expect. I mean, is that something you'd be
Absolutely. Yeah. Yeah. I have that conversation a lot. The typical, your timeline may be different from what's written in the books.
right? And I think that's where a lot of people get tangled up because that 10 to 14 day, window is out there and just about everybody seems to know it.
Yeah. It's out there, and it's, very misleading to a lot of patients because it's also dependent on, how hard they hit their head and, how many symptoms they had after the it's also dependent on so many different factors. Just telling patients that from the get-go, you know, don't hang your hat on this 10 to 14 days because it may, in fact, take longer than that. And so we'll deal with things as they come.
Yeah, I think that would be helpful. Well, so on behalf of the 10 to 30%, thank you so much for coming back and helping us understand all of this because it is a vexing place to be because you're neither here nor there. And I know a lot of people struggle, and I think they'll really benefit a lot from hearing what you had to say today. So thank you for coming back.
Yeah, thank you so much for having me. I'm so happy to be on this podcast, and certainly, it's tough, but it's really going to help a lot of people.
And maybe we'll do a live event and invite people to come in and ask questions. That could be fun.
Yes, absolutely. Thank you so much.
Thank you. Thanks for joining us for this week's episode of Rupture, the World of BestGuessistan. Today's episode featured Dr. Melody Merati, and we focused on the 10 to 30% of people with concussions who don't recover in 10 to 14 days. If this episode resonated with you, or if you know someone who could benefit from hearing it, please consider sharing it with them so they may find our community. And to support our work, like, comment, subscribe, share, or join us at bestguessistan.com. Bring us your rupture. Bring us your systems failure. We'd love to hear your story.